maintenant, je laisse la parole à Detlev GANTEN.
To conclude the whole conference, I will yield the floor to Detlev GANTEN from the World Health Summit. Detlev, are you here? Thank you very much. Good afternoon.
Exciting meeting, and I would have hoped, I see that 93 people listened. I would have hoped that many of the ministers of health and the minister of foreign affairs would have listened as well. Then I think their conclusions would be different. And I trust Benoit Miribel and the team of One Sustainable Health that they summarize this. You have done a wonderful job, Benoit and your team. Summarize it and bring it to the forefront of the politicians. And then I think we make a big step forward. I would just take up the word by Matthias Wismar. We have to be ambitious, yes, but we also have to be impatient. On the program, you see Peter Peart. Unfortunately, he sends his best regards. He is with the President of the European Commission in Africa. So he has asked me to talk and take some of his aspects. Peter has written a book, which I'm sure many of you have seen. And the title of the book is No Time to Lose. People are waiting. People are waiting for us, and people are waiting for politicians, and people are waiting for change. We are living in a Europe, which is a wonderful region in the world of peace and democracy, where politicians are being elected in order to do what they are elected for by the majority. And the majority of all societies, not only in Europe, all over the world, they want health. The most important value for everybody individually and of society is health. And health is more than medicine. Thinking about health is thinking about future generations. Thinking about health is thinking globally. We have seen that with the pandemics, but it's true for everything else. Thinking about equity and solidarity goes beyond gender, age, minorities, indigenous people, and so on. Equity, solidarity also means reframing health as an area of looking beyond borders, such as the EU, the African Union, and other areas of the world who are waiting for change. And cross-sectoral aspects, which have been mentioned several times, of course, they include holistic projects and holistic ideas like One Health. They include the Sustainable Development Goals, which really is the kind of umbrella concept of saving this world, a better world and a healthier world. And we do need this holistic approach, and we do need interaction of all sectors, public, private, academia, civil society, politics, and industry, which is easily said, but it's not that easily and that frequently being done. So no time to lose, being impatient. I think we have to communicate to those who work on governance, who are responsible for governance, to build the European Union, and that this is of the highest priority. All the EU initiatives which are already in place or which have started, ECDC, EMA, HERA, WHO Berlin Hub, and the WHO Lyon Hub on the Academies, all this needs to be incorporated into one system, one type of governance, and health and research, which is the basis, as we have heard many times, is kind of the basis of everything we do. It needs to have a rational basis. I'm sure, Karin Zipito, I unfortunately did not have a chance to listen to your talk, but I'm sure you mentioned the European Council for Health Research, which we kind of recommended as a group which was installed by the European Commission and European Parliament to make recommendations for a new structure for health research. I think the European Council for Health Research could be a wonderful beginning of such a new structure with a policy board where health and all policies can be materialized and can be exercised, with a scientific board where all the scientific input which have been discussed can be concentrated and then be brought together into a management board, which then organizes European health at all levels. And this management board, of course, needs money and needs power. There are already many things going on. And in every European country, there are several institutions which work across borders in all areas of health research. If these national research institutions get together, form a European Institute of Health with the financial support of national funding and of additional European funding, then we have made a major step forward. And I'm saying this because this can be done not waiting for political decisions. This can be done by science itself more efficiently than it's being done now. Now we have the French presidency. I'm sure this will be a major stimulus for this European Health Union. We then have the Czech presidency. We then have the Swedish presidency. I'm sure all those countries and responsible European nations will bring this European Health Union forward. And in Berlin, we have the World Trade Summit. You're all cordially invited. We'll have a chance to continue our discussions and continue pushing forward what needs to be done, a European Health Union. And I thank you very much for everything you have done in organizing this wonderful meeting. I'm sure it will bear fruits. Thank you very much.
Thank you. Il n'y a pas de temps à perdre, nous a dit Detlev GANTEN. C'est pour ça que cette initiative, cet élan
No time to lose, no time to waste. This is why we cannot stop here. And those will be the concluding words of Ole Peter OTTERSEN.
Well, the first thing to do is all the recommendations that have come up during this meeting. It's an impressive list of recommendations. Not only do we have to digest them, but we have to ensure that politicians and political decision makers will be able to digest them. So I would say, to be a bit provocative, this one-time event has limited value. I'm sorry to be so blunt. We have to follow up. We have to ensure that the momentum that we now have after this pandemic, that really has shown us that there are flaws in the system. There are inequities that we need to take seriously. We have to follow up on this momentum. And there are possibilities. Now we go into the new presidency of the summer, the Czech presidency. We should ensure that this discussion will prevail into the Czech presidency, perhaps in Berlin also in October. And then we have the Swedish presidency starting January next year. And I can tell you, I will do my best to ensure that we can have a discussion in Sweden during the Swedish presidency. Of course, I have to discuss this with multiple stakeholders, but I do think that at that time, we have, again, digested what we have heard today, and that we will be able to follow up, not least on what Detlev takes up as one of the central themes. How should we construct a governance system in Europe that gives Europe the voice that it must have on the global level when it comes to global health, and also take into account what we all think is required, the cross-sectoral perspective. We need a multi-stakeholder platform. And whether this will be in place during the Swedish presidency, well, that's a bit too optimistic, but we should stay on course and see this as not a single event, a singular event, but the start of a process that brings health firmly on the EU's political agenda. Thank you.
Thank you. C'était donc pas la fin, mais le début d'une grande
So it is
initiative.
not the end, but the beginning of a great initiative. And for the concluding words, I yield the floor to Benoît Meubel, who started the whole initiative. Thank you very much to the participants, to the speakers who have remained online. Everything has been said. I do note the opening message of Ole Peter, and I would like to extend a bunch of thanks to all our partners. First to Philia, it's a great network. They've connected with the Swedish, Czech and Spanish foundations in order to run a network, and NGOs act as partners. Speaking of partners, we have the Bullukian Foundation, BNP Paribas, Academies, Avenir, and Epochen. There are other foundations joining us, and because we need the help, all those organizations participate, and they are on the screen. I will not name them. It's a collective. It's a collective approach. It's a platform, and those convictions that we share, we want to actually present them to the mayors of the cities, of the large cities of Europe. We will communicate them to the ministers on Thursday with Jérôme Dimitri and Madam Ambassador Karolinska. Thank you to all the participants, the speakers who presented issues, stakes, and solutions. So thank you to Professor Detlev GANTEN, who actually started that forum over a year ago, and is always there with a great network. Thank you, Babette, Karine Sipier, and Oli Peter, who actually worked very hard, and it's indeed a beginning. It's not the end of a process. So thank you to the Vet Agro students. I don't know if they can go on screen, and thank you to Amandine Gauthier. Thank you to Erasmus. Great connection with the students from Myanmar. Thank you, Edwige Coupez, our journalist, and thank you, Jean-Pierre Claveran. And Bernard de la Villadea was also a first journalist. So thank you to all of you. If you are online and you have recommendations, please email them or send them via the chat. Marie-Laure Boulot will actually sift through those. Thank you to Max Claron and Brian Redkin and Jacques Ternoir, who actually help us with the formalization of those recommendations. We'll actually have to take a picture because it's Bernard was our first host. Thank you to the great technical team. So it's Artcast Medical. Thank you very much for your hard work. Please bear in mind that we are in tech responsibility. Please note, tech responsibility, no time to lose. Let's move on. That's everything we need to bear in mind. I think it will be replayed on the site. Thank you very much for your active participation.